My name's Steve Thomas. I'm a GP in the west of the city. I've been a GP at Dykeshall Road Medical Centre for 14 years, and I'm the clinical lead for Sheffield Clinical Commissioning Group in terms of mental health and learning disability portfolio. I think that the Clinical Commissioning Group has got clearly stated long-term aims, and those are to do with improving patient experience and access to care, and to improving quality and reducing health inequalities. And I think that as the mental health portfolio team, we want to address those issues specifically. We're very well aware that within the context of national statistics, that 1 in 6 people will, on an annual basis, experience some sort of mental health problem. And that equates really within our city of Sheffield to probably about 70,000 or so people having common mental health problems such as depression or anxiety. And on top of those 70,000, there's a significant number of people, probably around about 1,800 people who have severe mental illness such as psychosis. We've got around about 16,000 that we think have personality disorders. And we've got about 6,000 people in our city with dementia. And of course that's going to be an increasing part of our population as well. We've also got a learning disability population who are increasingly ageing, and they're living longer, and therefore they are developing long-term conditions, and particularly they're developing dementia as well. You'll read about the intensive support service that's just been recommissioned, and a new building that's been established, and that'd be an excellent article for you to read. I really want people to get a glimpse of the big picture and a vision of what's happening within our city and within our health economy, and to really realise that there's been such a wealth of already established good work, and that we're building on that, and that clinical commissioning really wants to take things on to the next step. We want quality services that will future-proof us. We're in a position where there's economic instability, and has been for a number of years. That provokes and prompts further mental health problems, difficulty with mental well-being, and we really want to be in a position where we can help our health economy establish good mental well-being as well as treating mental illness. We have a good clinical team within the mental health portfolio, but we really want wider engagement. There'll be a few different things that will happen. We may be going through a re-evaluation of a service, and we want to have wider engagement. So GPs, nurses, primary care staff, to be able to help us with that would be great, and that's the essence of clinical commissioning.